Both male and female patients want to look their best. So when performing a cosmetic consultation for a male or female patient, it's important to tailor the treatment specifically for that patient, not just the gender of the patient, but specifically for that patient. If you look at the statistics from the American Society for Plastic Surgery, released for 2013, 91% of cosmetic procedures are done in female patients, and 9% of cosmetic procedures are done in male patients. Now, this includes both invasive and non-invasive cosmetic procedures. So for dermatologists performing non-invasive or minimally invasive procedures, these numbers are still about right. If you look at the kind of procedures that patients are getting, both male and female, the top three are actually the same. It's neurotoxins, it's soft tissue fillers, and then laser hair removal. There are other cosmetic procedures that are common in both genders of patients, and that includes treatment of age spots with treatment like intense pulse light and microdermabrasion. Chemical peels are also very commonly performed. Based on my experience, there are some differences between male and female patients as far as the areas of treatment, specifically when it comes to the treatment of their face. I think for male patients, having some wrinkles or having some movement, for example, in their glabella or forehead or around the eyes, is more acceptable or perhaps even more desirable than in female patients that may want a bigger correction. I also think that for male patients, specifically treating the jawline can be very important to give that square jaw a really masculine look. And for most male patients, not all of male patients, but most male patients, you really want to try to avoid overcorrecting or feminizing their facial features, and that's something that I always discuss during the consultation with the patients. For female patients, not to make general statements, I think it's also important to specifically tailor the treatment to the patient that you're seeing. A lot of patients are coming in saying, look, I don't want to look fake, I don't want to look overcorrected, I don't want my lips to be too big, too full, I don't want my cheeks to look like I have golf balls in my cheeks. I really want a natural, soft correction. And I think that's really the point here. The point is that you want to tailor each treatment to the individual patient, but you have to keep in mind their gender identity. So you have to really talk to the patient and find out what it is that they're interested in, what kind of correction they would like, and then you could work from there. I often ask patients to bring photos of themselves when they were younger. Now it's so easy, they can just bring it on their phone, so we can see where they were 10, 15, 20 years ago and see if we can sort of turn the clock back more than anything else. When it comes to neurotoxins, there are some differences between male and female patients. Not in every patient, but in general terms, male patients require more neurotoxin to achieve the same level of correction. So for male patients, I often will correct with a larger amount or higher number of units in the glabella, the forehead, or around the eyes. With female patients, issues of raising the eyebrow often comes up, whereas in male patients, they often, when we talk about it, they often say, well, I don't want my eyebrow to look arched, I really want it to be straight. So that's another point that you have to discuss with the patient to make sure that you're correcting them to what their desired aesthetic is. There are also some subtle but real differences when it comes to using filler between male and female patients. In my personal experience, the female patient is much more concerned with correcting the area around the zygoma, the cheeks. And that may be driven by media, by what people see on television or magazines. Whereas in male patients, I find myself correcting the area around the zygoma some, but we mostly are concerned about squaring their jaw and really filling in some of the very deep lines. But we're not filling them completely, we're still leaving some wrinkles. So I think for male patients, in my experience, it's really about not overcorrecting. So a lot of male patients will still want to have a masculine appearance, which includes some lines and wrinkles, but really to soften that look. Whereas in female patients, in my experience, it's really more about shaping their facial features to really look younger or to look more refreshed. One point that's true for both male and female patients is that no one wants to have bruising, and everyone wants to be able to get back to their activities the same day or the next day. So making sure that you're taking care of that issue is very, very important. According to the American Society for Plastic Surgery, one of the most important things about male patients getting cosmetic procedures was how quickly they're able to get back to their office, how quickly they're able to get back to work. So discussing that with the patients is very important, and I really try to broaden that. I apply that to both male and female patients when we see them in the office. But I think the most important point here is that you have to discuss with a patient what it is that bothers them, what it is that they're interested in correcting, and maybe talk to them about what other things that can be done to improve their appearance. Laser resurfacing is also a very common procedure that I perform in my office for both male and female patients. And that may be for things like melasma or hyperpigmentation or lentiginous, sun-damaged spots. And that's really common both in male and female patients, and also acne scarring. In general terms, in my experience, male patients tend to have more severe acne scarring, so they may require more treatments with a resurfacing laser than female patients. When it comes to treating etched-in lines, I find that female patients really want those lines to either be completely gone or almost gone, whereas with male patients, we really are more interested in just decreasing the appearance, but still having some lines and wrinkles to not over-feminize their features if that's what they're interested in. So I think it's important to, again, tailor the treatment to each individual patient and to their specific wants and needs. In conclusion, I think it's really important not to generalize between male and female patients, but really to take each patient as an individual and really explain and discuss with the patient what it is that you can correct, how it is the patient can look better, improve their appearance, and what it is that we can do with minimal downtime or minimal side effects for each individual patient.